Hello, my name is Laura. I am the nurse trainee that will be conducting your comprehensive physical exam today. It's very good to meet you. Feel free to get comfortable and take a seat. So, have you been told about the comprehensive exam today? Okay, so basically it's like your annual physical exam that you would typically get, except this is going to be a little bit more detailed today. So I'd just like to ask you before we begin with the exam today, do you have a spare roughly 40 to 50 minutes for this examination today? Great. So because I am a nurse in training, I need to be assessed in all the possible areas that I would conduct a physical exam in. Brilliant. So let's go have a quick look at your medical forms that you filled in before you came into the room. Okay, so it looks like you last visited your doctor for a physical exam on October 15th, 2021, is that right? Okay. And there are a couple of questions that you didn't fill out, so if it's alright with you, do you mind if I just ask you those questions? Okay, so do you smoke? And do you drink at all? Okay. And what medications are you currently taking? It says that you take some, but you didn't mention what they were. Okay. Alright, and sleep. How much sleep do you get every night on average? Okay. Okay, and that is your medical form filled out, and now we can begin with your comprehensive physical exam. Before we dive into that though, I'd just like to ask you before I begin with that, do you have any causes for concern for me today? Do you have any problems you would like for me to have a look at or try to address? Okay, so I will actually be looking at that specific part of the area during the physical exam, so I will be sure to address that concern as I look at that part of the body for you. Okay, anything else? Okay, just going to make a quick note of the area of concern for you. Okay, so that is your medical form filled out. So now we can begin with your physical. So I'm going to begin today by taking your blood pressure. So I'm just going to begin by putting on a pair of gloves. Okay, so now I'm going to ask you if you could please put out this arm for me. No, you don't need to roll up your sleeve or anything. This will work just fine with it. So I'm just gonna put your arm in the cuff. Slide it in for me. Excellent. Okay, so this is going to feel a little tight. And I'm also going to be listening with the stethoscope as I do so, okay? Okay, ready? Okay. to make a note of your blood pressure from that arm. And now I'm going to be taking your blood pressure in your other arm. So just uncuff your arm here. Okay, and now this arm, if you don't mind. Brilliant. Perfect. Same again. Okay, so that is your blood pressure exam complete. I have to refer back to the stethoscope in just a moment. So just uncuff your arm now. Okay, and you can feel free to just relax your arms now. Okay, so now I'm going to be taking your pulse. I'm going to be taking your pulse in both of your wrists and both of your inner elbows, okay? So I'm going to begin by taking your pulse in this wrist. You can just lay out your arm for me. Perfect. So I'm going to take your pulse now, okay? Okay. Try the wrist. Okay, perfect. And now I'm going to be taking your pulse from both of your inner elbows. So if you could just lay out both of your arms nice and flat on the table for me. Perfect. Okay, good. Okay, perfect. Nice healthy pulse and blood pressure. Okay, so now I'm going to move on to listening to both your heart and your lungs. So I'm going to need to listen to your front and your back for this part of the exam. So if it's okay with you, if you could please expose this part of your chest here, just so that I can have a nice listen to your heart and lungs. That's perfect. Okay. Alright, let's begin by listening to your heart. I'm going to warm up the bell first. On both sides, just so it's nice and warm. It's not too cold for your system. Okay. So just breathe nice and naturally for me. I'm just listening to your heart right now. Okay. Okay. Okay, could you breathe in for me? Hold it out. Good. Breathe in again. And breathe out. Good. Breathe in. And breathe out. Good. And again, breathe in. And breathe out. Good. So if you don't mind, if that's okay with you, if you're able to just expose your back for me, just so that I can put the stethoscope on your back so that I can listen to your lungs. That's perfect. Thank you very much. Okay. Yeah, just breathe at a nice, natural pace for me. Good. 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 Okay, breathe in. And breathe out. Good. Breathe in. And breathe out. Good. Breathe in. Breathe out. Good. Last time, breathe in. Breathe out. Good. Now I want you to take some shallow breaths. So quickly inhale, quickly exhale. One time here. Good. And again. And again. Last time. Perfect. Brilliant. You can now feel free to cover your chest and back. Okay. Just going to make a little note of that. Everything's sounding great. Okay. So now I'm going to be moving on to your extensive physical examination. So for this physical exam today, I'm going to be having a look at your eyes, face, testing the nerves of your face, having a look around your lips and inside your mouth, up your nose, around your ears, inside your ears, checking your neck, checking your reflexes, and checking your hair and scalp. Is that okay? Okay, brilliant. So I'm going to begin from the top down. So firstly, I'm going to be having a look at your hairline, scalp, and the lengths of your hair. I'm going to be examining for any lesions, inflammation, any moles, things of that nature. Okay. So I may need to use a pen light just to look through the lengths of your hair, but we'll see, okay? So do I have permission to begin your physical exam? Okay. Alright. So I'm just beginning by pulling up your lengths of your hair and just having a look through the lens just to see if there's any redness, scabbing, anything like that. So, how is this feeling? Is this feeling tender, sore, anything of the nature? Okay. Okay. So now I'm going to gently tap around your hairline and let me know if you feel any discomfort at all, okay? Okay. None? Okay, good. And the other side? Okay, is that still okay? Still okay, good. Okay, so now I'm going to be examining the rest of your hair, looking at the bottom of your head and behind your ears. Still feeling okay? Good. So now I'm going to be using a pen light just to look in greater detail through the lengths of your hair, okay? pull your hair back over here. Okay, looking good. Let's draw the hairline. Okay, so your hairline, scalp, and hair are looking nice and healthy. So now I'm going to be moving on to examining inside both of your ears. I am going to be having a look down each of your ear canals with this otoscope. This has a very thin tip to it so that it may be easily inserted down your ear canal without causing you any pain or discomfort. Okay, so am I okay to proceed? Okay, thank you. Okay, so what ear was it that you said you had the problem with? The other one, okay. I'll have a look at that just a second. So it says on your medical charts that you get ear cleanings often, is that correct? Okay, and how are those working out for you? Okay, good. So this ear is looking very healthy. Okay. I don't see any issues at all. A very light earwax buildup. No debris. Nothing irregular. The colour's really nice. It's good. Alright, so now let's have a look at this ear. This is the ear you said you had the problem with. Yeah. Okay. So I think I see where your problem is. You have a little bit of earwax build up here. I can definitely remove that for you though if you'd like. Of course, happy to. Other than that though, the colour looks really healthy. Nothing else seems to be an issue in here. The earwax buildup is very slight, but I'm sure by removing that today you will feel a lot more comfort in your ear. So has it been giving you earaches? Okay, a little bit of tenderness, I see. Okay. So I am going to be using a tool to remove that I'm sure you're quite familiar with. This is an ear cleaning / ear picking tool. You may have come into contact with the wooden version, plastic version, steel version, yeah. So I use the wooden one. I find that this is very accurate whilst also being very gentle for my patients. Am I okay to proceed with the earwax buildup removal? Okay. Not too much, but I think the positioning of where it is probably what's causing you all those issues. Because it seems to have wedged itself right down. I can I find that this is good practice for me too. Because there isn't too much earwax inside your ear canal, this won't take too long to remove. almost done. Okay, so that is your earwax removed. I'm just going to have a quick look down the ear canal again with the otoscope just to make sure I didn't miss any. Okay, it's looking good. Okay, how's your ear feel now? Good. Good, I'm glad it feels a little better. Okay, so your ear canals are nice and healthy and now both clean. So now I'm just going to be making some notes of the examinations that I have performed on you today so far. Okay. Ear cleaning. Head exam. Okay. So that is your ear cleaning complete. So now I'm going to be testing and examining your eyes. Okay, so I'm first going to begin with the Snellen chart. I'm sure you're quite familiar with this. Yeah. So with both of your eyes open for me, if you could please begin scanning the chart and letting me know what letters you see. So what about this one up here? What does this look like to you? E, perfect. So now, if you could close your left eye and cover it with your hand, scan the second line here for me. Let me know what you see. F, perfect. And what about this letter? P, perfect. So now if you could cover your right eye and cover it with your hand and expose your left eye. Scan the third line for me. Tell me what you see. T, perfect. This one. O, perfect. This one. Z, perfect. So now with both of your eyes open, if you could scan this line for me. What do you see? L, perfect. P, perfect. E, perfect, good. And this one? D, perfect. And now covering your left eye and exposing your right eye, have a look at the fifth line and let me know what you see. P, perfect. And this one? E, good. C, good. F, perfect. What about this one? D, perfect. And now cover the opposite eye and we'll go again. Have a look at the sixth line. What do you see here? E, good. D, good. F, good. C, good. Z, perfect. P, great. And now if you could open both of your eyes, let's have a look at this line here. Try and give this one a go for me. Okay. F, good. E, good. L, good. O, good. P, good. Z, great. D, perfect. And would you like to try this line here? Sure. D, perfect. E, good. F, good. P, good. O, good. T, good. E, perfect. C, perfect. Very good. So now I would like if you could please follow this light with your eyes. Keep your head fixed nice and still and just allow your eyes to scan in the direction that the light is going, okay? Okay. Just to check with you, is this brightness okay? Okay, good. keep your head nice and still and follow the light for me if you could, okay? Okay, brilliant. Just like that. Just follow the light as best as you can. Good. Good. Just keep on following the light. Good. Good. Up, down, left, right, left, right, up, down, up, down, left, right, left, right, left, right, up, down, up, down, left, left, right, left, right, up, down, up, down. Perfect. So now I'm going to be raising my fingers, and I would just like for you to let me know how many fingers I'm holding up, okay? Perfect. Perfect. Good. 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 Perfect. Good. 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 Perfect. Just going to make a couple notes now. Okay, so now I would like for you to keep your eyes fixated on the tip of this pen, right at the blue part, right here. And I'm going to move the pen closer to you, and I would like for you to let me know when the pen goes blurry, okay? Just keep your eyes fixated right on the tip of this pen here, okay? Perfect. Okay. Okay. So now I would like for you to keep your eyes fixated on my nose. I'm going to bring some fingers into your vision, and I'd like for you to let me know when you see my fingers come into your vision, okay? Okay. Good. 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 Perfect. 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 Good. Brilliant. So now I'm going to be showing you this box, and I would like if you could please identify the colours that you see on the box. Okay, starting here. Okay, here. Okay, up here. Okay, here. Okay, here. 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 Okay, next side. Here. 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 Over here. Here. Down here. Right next to it. Right next to that. This one. This one. This one. Perfect. Next side. Up here. Down here. What are the two colours here? Good. What about the two colours up here? Good. This one. Good. This one. Good. Last side. This one. Okay. This one. Good. This one. Good. This one. Good. This one. Good. What are the two colours here? Good. And down here. Good. Up here. Good. And do these two colours look different at all to each other? Okay. And this one. Okay. Perfect. So now, if it's alright with you, I will need to have a little examination of your eyes. So I'm just going to be using the pen light to have a look around and more closely almost inside the eye, just scanning your cornea, retina, and your eyes in general. Is that okay? Alright. Just having a little look at your eye. You can blink as much as you need to. You certainly don't need to force your eyes open. Okay. Okay. Okay, can you look down for me? Okay. Can you look up for me? Okay, down again. And up again. Okay. Okay. Alright. So now I don't need the pen light. I'm just going to have very slightly palpating around your eye. How's this feel? Does this feel okay? Okay, perfect. So now I'm going to be examining your nose and nasal passage. So I'm going to be doing this with my otoscope again. So I'm going to need to ask you to tilt your head up ever so slightly. And again, with the thin-tipped part of this tool, I'm just going to be having a look up inside each of your nostrils. Is that okay? Okay. Alright. Just keep your head up. You can feel free to breathe at your natural pace. So do you have any sleeping issues? Do you have sleep apnea? Any snoring, breathing issues? Okay. So I'd like if you could just cover this nostril. Take a deep breath in through this nostril. Out. Good. Cover the other nostril. Breathe in at this one. Okay. Alright. You can drop your hand now. Breathe in for me through your nose. And out. And again, breathe in. And out. Okay. Brilliant. Let's make a few notes now. Okay. So now I'm going to need to examine your lips and inside your mouth. It's going to be having a quick look at your inner cheeks, your teeth, and your gums, as well as your tongue, okay? Okay. So if you could just part your mouth open slightly for me, and if it's alright with you, am I okay to proceed with having a little look with my fingers inside your mouth? Okay. Okay, so I'm just pulling at your lip ever so slightly. Just let me know if there's any discomfort. Okay. Are you having any dental issues, or do you have any mouth concerns? No. Okay. I'm just going to grab the pen light, have a little look inside your mouth here. Is this feeling okay? Okay, good. Okay, if you could just drop your tongue and put it up your mouth for me. Okay. Okay. Now, can you raise your tongue to the roof of your mouth? Okay, can you drop it as far down as it will go? Okay. Okay. Now I'm just going to move your tongue to the side like this. Good. And I'm going to move it to the other side. Okay. Now could you go off for me? Okay. Perfect. Okay, so now I'm going to be testing some of your facial nerves. So I'd like if you could please follow these instructions to the best of your ability for me. Brilliant. So could you raise your eyebrows? Okay. Could you scrunch your eyebrows? Okay. Can you give me a big smile? Okay. And can you frown for me? Okay. So I'd like for you to hold that smiling pose for me, and I'm just going to gently touch on your jaw if that's okay. 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 Do you have TMJ at all? Okay. Does this hurt? Okay. Okay, perfect. Feel free to relax your jaw and muscles now. Okay. So now I'm just going to be having a look at your neck and assessing your lymph nodes. Okay. So you can just feel free to relax your neck, and I'm going to gently palpate alongside your neck, okay? Okay. Have you been sick recently? Had a cold or anything? Okay. How does this feel? Does this feel okay? Okay. Okay, perfect. Okay. So now I would like if you could please close your eyes for me. I'm just going to be examining your face overall, checking the texture and whatnot, just checking for any irregularities, lesions, things of that nature. I'm going to be using my pen light to help assist me have a look at your skin at closer detail, okay? Close your eyes for me. Okay. Okay, perfect. You can feel free to open your eyes now. Okay. Okay, so now I'm going to be checking your hearing. So I'm going to first perform this examination today by whispering different numbers and phrases into each of your ears. And I would like if you could please repeat them back to me. Okay, brilliant. So we're going to begin with this ear, and if you could please cover your other ear with your hand. Okay, thank you. Tortoise, Lima, 9. Tortoise, Lima, 9. Brilliant. And cover this ear. Okay, and we'll just go back and forth like that, okay? Click, shoe, 7. Click, shoe, 7. Brilliant. And back to this ear. Whisper, ear, nail. Whisper, ear, nail. Good. Comb, honey, brush. Comb, honey, brush. Clap, 6, 10. Clap, 6, 10. Good. Bucket, rocket, truck. Bucket, rocket, truck. Excellent. 99, 100, 2. 99, 100, 2. Fantastic. Examination, 4, 7. Examination, 4, 7. Excellent. 1, 0, 2. 1, 0, 2. Good. Keychain, gorilla, marble. Keychain, gorilla, marble. Good. Monkey, koala, dog. Monkey, koala, dog. Good. Orange, blue, red. Orange, blue, red. Good. 30, 25, 22. 30, 25, 22. Brilliant. 88, 70, 79. 88, 70, 79. Excellent. So now I'm going to test the frequency in which you can hear different sounds. So I have 2 different tuning forks. This is a higher frequency, this is a lower frequency, and this will help me identify what hertz you can hear sound at. Okay, so I'm just going to tap this against my palm, and then I'm going to keep it next to this ear. I would like for you to let me know when the sound begins and when the sound ends, okay? Okay. Okay, now let's do this ear. Okay, let's do this ear again. Okay, let's do this ear as well. Okay, so now when I hit the tuning fork, I'm going to be scanning it from one ear to the other. Let me know when you hear it begin. Let me know when you hear it end, okay? One more time. Okay, so now moving on to the higher pitched tuning fork, I'm going to do the same thing again. Let me know when you think the sound begins and ends, and then I will stop, okay? Okay. Okay, I'm going to do that one more time, and then we'll examine each ear individually with the tuning fork. Okay. Okay, so now let's examine how each ear individually hears the tuning fork. So starting with this ear, let me know when the sound begins and when the sound ends. Okay, and this ear. Okay, let's do each ear one more time. Okay, last time for this ear. Okay, brilliant. Okay, let's make a little note of that. Okay, so now we're going to be moving on to the last part of your examination today, and I'm simply going to be testing your reflexes. Okay, so if you just let your legs just swing over the table there, like that, that's perfect. And I'm just going to gently tap on your knees, and hopefully we'll get a reaction from them. Okay. Okay, and your other knee. Okay. Okay, one more time. Okay, excellent. Just one more thing I would like to do, which I think is quite important for human health, is just having a little look down your arms and your neck. I'm just going to be having a quick look at your moles on your skin, if you have any, just to check for their colour, size, and general appearance, okay? Okay. Alright, just scanning up and down your arms. Okay, have a look between your fingers, under your nails. Moles can crop up in all sorts of interesting places. Okay, check your fingers here. Under the nails here, good. Okay, let's have a little look down your neck. Do you have any moles that you'd like to have a talk about today? Okay, It's nothing out the ordinary for you. Okay. Okay, excellent. So if you find that you have any new moles, or if you find that your moles are changing in colour, size, appearance, you can always come in and have a chat with your GP or dermatologist about them. Okay, so just to let you know, out of all of the physical examinations and general examinations that I performed on you today, everything appears to be in perfect working order. So I just wanted to say thank you so much for taking the time out of your day today to allow me to train on you. This has been very helpful for my career overall, and I cannot thank you enough for your time and patience today. Okay, well, thank you very much for coming in today, and I hope you have a lovely rest of your day. Take care. Goodbye.